want to welcome everyone to today's Ethnic Media Services Zoom News Conference, which we are presenting in partnership with a very valued colleague at the California Department of Aging. Our topic today is caregiving, a topic that touches almost all of us, and the extraordinary role of CalGrows, a training program run by the California Department of Aging for home healthcare workers and caregivers. CalGrows provides free, easy to access, quality courses to empower caregivers and build the knowledgeable workforce California needs to better serve our aging population. Caregivers, both paid direct care workers and unpaid family and friend caregivers, are primarily people of color and women. They are the backbone of healthcare for the state's aging population, which is growing rapidly. By 2030, people 60 years and older will constitute 1 out of 4 Californians. We are hosting today's program to spread the word about CalGrows to our audiences before the training program ends at the end of August. Our speakers today include Renita Polk, Project Director for CalGrows, who is standing in today for Susan Desmarois, Director of California Department of Aging, who was called away at the last minute to a budget hearing. Thank you so much, Renita, for leading us off today. Also joining us will be Dr. V.J. Periyakoil, Director of Stanford Age Research Center and Director of Palliative Care Education and Training at Stanford University School of Medicine. Anni Chung, CEO of Self-Help for the Elderly, an organization based in San Francisco that provides health, educational, social, and recreational services to over 40,000 older adults a year. And 2 caregivers who have agreed to share their experiences. Joe Rodriguez, former reporter and editor with the San Jose Mercury News, who is now retired and is a caretaker for his sister in San Bernardino. And Miss May Guo, a CalGrows trainee who works with self-help for the elderly. We ask our speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean. We ask reporters to enter questions in the chat. We will send a video of today's briefing and expanded bios with contact information for each speaker to all participants later today. Our speakers are also encouraged to monitor the questions in the chat and answer those they feel are most relevant to their experience or expertise. So we begin now with Renita Polk, who will provide an overview of CalGrows, which is a key component of California Department of Aging's 10-year master plan on aging. Ms. Polk, thank you. Please begin and welcome.
Hello, and thank you for that introduction. As Sandy mentioned, my name is Renita Polk. I am leading the implementation of CalGrows here at the Department of Aging. I work in the Office of Direct Care Workforce here at the department. I'm very excited to be here to talk to you all about this really important topic, which is caregiving. And it's a very important topic because California's population is getting older. With the number of Californians over the age of 60 projected to reach 10.8 million by 2030, 1/4 of our state's residents will require varying levels of care. Meeting the needs of our aging population demands a robust and skilled caregiver workforce. And however, California currently faces a projected labor shortage of up to 3.2 million paid direct care workers. Caregivers and home healthcare workers play a pivotal role as the backbones of California's healthcare system, and it's critically important that we support this career pipeline as we look toward the years to come. The California Department of Aging is a big part of providing aging resources to residents across the state. It's a portal to hundreds of programs that are aimed at improving the lives of our older adult population, including CalGrows. CalGrows provides comprehensive, free online training for both paid and unpaid caregivers, and it aims to equip them with valuable skills and pave the way for new career possibilities. The program offers free and accessible training with hundreds of courses offered both online and in person, and all of these courses are completely free to all participants. Courses are offered in 9 different languages to help meet the needs of California's diverse population. And those languages include English, Spanish, Armenian, Cantonese, Korean, Mandarin, Tagalog, Russian, and Vietnamese. Incentives are available to qualified paid caregiver participants and who can earn up to $6,000 when they successfully complete training coursework. And there's a wide range of course topics, including Alzheimer's disease and related dementia, cultural diversity, food safety, infection control, provider and consumer communication, and many more. Since its inception, CalGrows has achieved significant milestones. There are currently over 25,000 courses that have been completed through the program. And this translates to countless caregivers gaining valuable skills and knowledge to better serve California's aging population. There have been over 6,000 caregivers that have participated in the program. And this is creating a growing network of trained and empowered caregivers to ensure a stronger support system for seniors across the state. And over $2 million have been awarded in incentives. This is a tangible investment in caregivers and acknowledges their vital role and incentivizes their continued commitment to the field. And CalGrows is only one part of the Department of Aging and the state of California's efforts to build a health workforce that represents California's diverse communities and provides people with the quality care that they deserve, while addressing the growing workforce shortages throughout the state's health and human services system. Training courses are available through the program until August of this year. And there's still time to take advantage of the free trainings and stipend funds available by visiting calgrows.com. And so I know we have some other great speakers that are going to be speaking today. So I will stop there and just, again, thank you all for being here to talk about this really important topic.
Thank you, Ms. Polk. Could we ask you a couple of questions? One
Yes.
from me is, how long does the course take? How many weeks are you engaging in these online classes, and are they once a week, several times a week? What would we anticipate committing in terms of time?
That is a great question. Thank you. So it's really dependent on the course, and there's a wide range of different options. There are some courses that it's, a short 15, 30-minute quick course that's just one time. And there are other courses that are maybe several hours that you can kind of take the course over multiple days. Whenever you have time, and kind of stop in at one point and then come back later to finish it. And then there are some courses that are multiple sessions over the course of a couple of weeks. So there's kind of a course out there that can fit anyone's schedule. And it's really just dependent on how much time that the student has to be able to participate in courses. So no matter what your schedule, there should be a course that you can find that will fit that schedule.
And a question about the ending of the program at the end of August. Is there a possibility it will be renewed, or was this part of a kind of a budget set time period that it received fund for? Or is there a way we could, in a way, promote its continuation?
Thank you. That's a great question. So the timeline for the program, that is the deadline to use the funding. The program was funded through the Federal American Rescue Plan Act. And so due to regulations around that funding and that act, the funding has to be used by a certain time. So that is why there is that deadline to the program. However, we do recognize that this is an ongoing need, and with California's population getting older, there will be a continued need to train caregivers. And so this is something that the department is thinking about and talking about. And so we acknowledge that this program, it will be ending, but it doesn't mean that the need will end.
Thank you. My question was echoed by Anjana Nagarajan, and I just wanted to ask Anjana if you had an additional question to ask, or if Ms. Polk more or less answered. Do you want to unmute?
Thank you. You asked my question beautifully, better than me. But do you have any more information on whether this training is vetted? So a person who wants to hire somebody, how will they know that they did well in that course? And especially for things like Alzheimer's care, which requires very technical competence.
Yes, so thank you for the question. So I'll kind of answer that in two different ways. So the first is that everyone, when they complete the course, they will receive a certificate of completion. But I do want to stress that the courses that are offered through the CalGrows program, they do not confer any kind of certification or anything like that. So I do want to make that clear. But everyone that takes the course, successfully completes the courses, will receive a certificate of completion. And I also do just want to point out that through the application process for grantees to put forward these training courses, we did have a panel of subject matter experts that were a part of the panel that looked at all of these applications for the development of the courses and reviewed them when we were awarding grant funding to develop these courses.
Thank you. And then a final question for you, although please don't go away because there'll be more questions I know you can address online. And thank you, Connie, for also monitoring the chat. Mark Hedin, do you want to ask your question?
Sure. I assume you can hear me. Just
okay.
curious, the online courses sort of live forever. Will that be the case here? Why would something that's sort of static like that end? I understand that stipends and such have a limited,
Okay, Mark,
capacity, but
thank you.
coursework I
for your
think
question.
should stay on.
You're having trouble with the phone, but let's ask Ms. Polk that question. Will the courses, the content of the courses, are they videotaped in some way? Is there any way that people can access them after CalGrows ends?
Thank you for the question. So currently, we the department is kind of working on a way to develop a learning management system. So some of these courses can kind of live on after the end of the program. However, we're still kind of building and developing that system. So it may not be available right when the program ends, but the hope and the goal is that in the future that some of these courses will be maintained on our learning management system. So we're currently working on it.
Thank you. So please don't go away, and we will move on to our next speaker, Dr. Vijay Periyakoil, who, as I mentioned, directs Stanford Age Research Center and is the director of palliative care, education, and training at Stanford University School of Medicine. I should also say she was one of the very early supporters of ethnic media training programs in the field of end-of-life care, hospice. She's a real pioneer in the whole field of caring for aging. So we couldn't think of a more appropriate speaker to speak to the value of caring, and training caregivers. Thank you, Dr. Periyakoil.
Thank you so much for having me. Can you hear me okay,
Yes.
everyone?
Yes, you're
wonderful. Wonderful. So thank you. It's such a pleasure to be here. I am so grateful to our state and to Dr. Polk and all the leadership in the state for seeing the magnitude of this problem and taking the first step towards the solution. I put in the chat the link to our training program and happy to answer more questions about it. I want to be, the reason I made that statement about seeing the magnitude of the problem and thanking the state for that is this problem is so huge, so massive. You know, we typically talk about the elephant in the room. This is not as small as an elephant. This is a massive problem. As medicine gets more and more successful at what we do, and as people live longer, which is what I want. So a lot of what I do is longevity-based research work. We are also supporting an increasingly aging population, not just in terms of age, but we are also, if you look at the causes of mortality, it still remains the same. It's heart disease followed by cancer. COVID was a little bit of an unusual blip, and thankfully that is getting controlled so much better. But pretty much all of us, I see a whole bunch of almost like 62 people so far, no, 68, something like that. Most of us, at least 60 of us, are going to eventually live with one or more chronic conditions for many years. with the support of our healthcare team, with the support of our friends and family. And we will likely die of something that we have, of a disease condition or conditions, because multimorbidity is very common in older adults, which is the medical term for having many chronic illnesses at the same time. And we are going to die deaths that are from these diseases. And so that sounds like a very obvious statement, but what I'm talking about is death due to accident, sudden death due to an accident, or sudden death where you have your first heart attack and keel over and fall down, are less common. As we get older, we will end up having heart disease, some type of cancer that is treatable, and people often live for years with that. The national data looking at it, what they found is, you're probably familiar with this concept of compression of morbidity, where the job of medicine done right, if I'm doing my job right, if all my colleagues are doing our job right, we will make sure that all of us, all Americans, have amazing quality of life, 100% functional status, amazing quality of life. And then one morning, as one of my patients described, poof, you wake up dead, right? So until that moment, you're dying, you're running a half marathon, you're swimming with the sharks, you're doing bungee jumping, etc. That's sort of the ideal that we are working towards. In reality, as I was saying earlier, a lot of us live for many years with chronic illnesses. And what we have found is in the last 2 years of life is when people's debility increases. Okay, so that's one aspect of it, right? So when our debility increases, what will happen is, this is when we need, I mentioned heart disease, cancer, COVID was a blip. Then strokes is another major cause of mortality, morbidity, followed by lung disease. And then after that is dementia, followed by diabetes, liver disease, and then kidney problems. So for all of us, because it's not a them problem, it's a us problem. That's the first thing that we need to realize. So it is a us problem, meaning you and I, if we live long enough, are going to go through this. So when they looked at the data in 2021, they found that there are 38 million American family caregivers, and the cost of the care that they provide is estimated to be several billion. So it was 600 billion was the number that they came up in 2021. And how did they get that number? 38 million family caregivers providing 18 hours of care per week, which is like a small amount if you really think about it, right? 7 days, 24 hours each day. Whereas if you think about 18 hours per week divided by 7, that is less than 3 hours of care. And that is, of course, an average, but that is really an underestimate of the amount of care that is given. And then if you really think about 36 billion hours of care at the average value of $16.59, that's where that number comes from. So we're talking 600 billion. That's not anybody's pocket change, right? $600 billion. So this is family caregiving, and 1 in 2 older adults who's living in the community is going to need some kind of help with activities of daily living. Activities of daily living is getting showered, getting dressed, toileting. These are activities of daily living. You need to do this in order to go through your day. I'm not even talking instrumental activities of daily living, which include picking up the phone, balancing your checkbook, etc. Forget that for a moment. Let's just look at activities of daily living, and 1 in 2 older adults needs help with that in the community. So then we talked about family caregiving. So what happens to the family caregivers? It's emotionally taxing. It takes a huge physical toll, because if you're lifting a loved one, right, and then you're throwing your back, or you're there and you're constantly taking care of this person, so therefore your social activities are terribly curtailed. Chronic loneliness is very common in people who are providing care over a period of time. So physically demanding, emotionally demanding, psychologically, socially demanding. And these people are all untrained, right? Like totally untrained. Would you ever have anyone, let's say we're talking about a Ford Escort car here. Would you ever hand a key to anyone who's never driven and say, you know, good luck, you're on your own, don't hit anyone, don't kill yourself, goodbye? That is the kind of work that we are doing implicitly, by which we are giving the keys of caregiving to family members who have zero training. They are so emotionally vested because it's their loved one that's struggling. Because of this, they are not able to be part of the workforce and be gainfully employed. Or even worse, they're doing the work in addition to taking care of their loved ones, right? So there's this huge gap where you have growing number of Americans who are aging, living with chronic illnesses, living much longer because of advances in medical science, and they have tremendous amount of caregiver needs. Like the number one issue I hear from my cancer patients is they need a ride to their chemotherapy. They need someone to take them, pick them up, and when they get home, help them to get into bed and somebody to give them some food, right? So we're not talking just about dementia. Dementia, of course, incredibly important, but I'm talking about cancer, about heart disease, all of the chronic illnesses, right? We call them the big C's: cancer, about chronic illness, cognitive impairment, etc. Congestive heart failure, chronic kidney disease.
Dr. Periyakoil, I just need you to wrap up. This is so fascinating, but there are a couple of questions, and you have about 1 more minute.
Gotcha. That's good. So all of this, I was giving you all this background to say that there is this huge gaping hole which needs to be filled by our direct care workers. I see direct care workers as the unseen connective tissue that is holding the healthcare system together. And the more we invest in their knowledge and education, the more we do by the way of caregiver training, the better the healthcare system is going to be able to serve you and me, because this is a us problem, not a them problem. So with that, what I did was I put in the chat the link to our program. We've been doing this for years because I think it's incredibly important. So with that, I'm going to stop and hand it back to Sandy, our moderator.
Dr. Periyakoil, it is really fantastic to hear your lived experience and vast expertise on the critical role of caregiving and family and friend caregivers. We go now to Anni Chung of Self-Help for the Elderly, who will speak more directly to paid professional home health care workers and the importance of training for this group. And Anni, there's almost nothing you haven't experienced in the many years you too have been a pioneer in raising awareness of the whole health disparities in healthcare, addressing older adults, particularly in the AAPI community. Thank you for joining us.
Thank you very much, Sandy, my good friend for many, many years. Hi, everyone. Can everyone hear me okay? So we're in our conference room at our office in San Francisco. And as Sandy introduced us earlier before, self-help started way back in 1966. So this is like our 58th year in existence. And caregiving and providing training to immigrant workers has been one of the top priorities of self-help since our establishment back in 1966. And that's why we call self-help for the elderly, because first of all, with an older worker, let's say they immigrated into the United States when they're in their late 50s or early 60s, many didn't know that in order for the elderly to receive Medicare when they turn 65 years old, right now it's probably 66 and 67 before they actually get Medicare, they have to have a work history of 10 years or 40 quarters. And unless and until they paid into the what we call the Social Security FICA system, many immigrant workers that work for cash payment will not be eligible for Medicare. Now, when you turn 65 and older and didn't have a medical insurance program, you're really in a lot of trouble, right? You need hospitalization and medical care through our Medicare system. So self-help for the elderly started our employment program really as one of the top priorities and our core mission. So Sandy asked me to explain a little bit, why paid caregivers are such an important part of our community. So first of all, if you have an elderly or aging parent or grandparent, or a relative or a friend that just come out of the hospital and there's nobody in the home to take care of them, you could imagine, like, from the time that they wake up in the morning and need to get dressed, need to go to the bathroom, need to, get some personal grooming and personal care, and then they needed to have breakfast, and then they needed to do some exercise, and then they needed to have lunch. And then they needed, certain medication or some maybe medical treatment at home if they're diabetes, or they might need insulin. Then, by nighttime, they needed dinner, and then you need to get an elderly patient ready for bed. So just close your eyes and imagine yourself to be a caregiver, either a family caregiver that is not paid, or the family can afford to hire a paid caregiver. That 8 hours is a long day and a very, very hard working, right? It's a hard job. So what as Self-Help for the Elderly's really core mission is to provide professional licensed home health aide training to literally thousands and thousands of older immigrant workers who already like to take care of people. You have to have that natural aptitude. You have to be loving. You have to be patient. You have to really be serious about caring for a patient who's elderly, sometimes don't speak English, and sometimes might have difficulty in communicating what they need. So we started our licensed home health aide class in the early 70s. And it's 120 hours of training. And after the training, you take a test. And when you pass the test, you will receive a license from the state of California that allow you to practice as a home health aide in any part of California. So of course, right here in San Francisco and Bay Area, where Self-Help for the Elderly has lots of branch senior centers and offices, we started to receive a lot of job orders, from, again, families of elderly that needed a caregiver to take care of the elderly at home so that they could go to work. So I have Roy here, who manages our home health aide and housekeeping and vocational employment officers. And I don't know how many orders Roy gets in a day, right? Trying to hire a paid home health aide to take care of the sick patient at home. So this becomes very important project of self-help. I think over the past 40 years, self-help must have trained over 4,000 to 5,000 licensed home health aides. And once they get to be more experienced, then our home health aides usually then step up, and they might take further education to become a certified nursing aide. Then they started to maybe work in the medical settings, nursing homes, or skilled nursing, or even hospitals. So now, as Self-Help for the Elderly, we provide licensed home health aide training to we offer 3 classes in a year, but we also offer 3 or 4 classes, because once the home health aide maintain their home health aide license, every 2 years, they needed to attend 24 hours of continual education in order to get their license renewed every 2 years. So of course, Self-Help for the Elderly also provide these renewal classes, all free of charge, because we do get some support from our Office of Economic and Workforce Development to provide a kind of what they call health sector vocational training. So right now, we're not charging any fees, but outside private schools usually charge anywhere from $2,000 to $3,000 per course if you want to get into a licensed home health aide course. But for now, we offered it in Cantonese and English. And a little bit, in the future, we're looking for partners that we may offer the training in Vietnamese and also Tagalog. So that's the licensed home health aide classes that we provide to professional paid home health aides. So I'll stop here and then send
Anni,
any questions.
could you explain how the CalGrows training program is part of your overall training initiative? How you work with CalGrows, how CalGrows aligns with your mission?
Absolutely. So thanks to CalGrows. So thanks to Connie and Dr. Renita Polk. So Self-Help for the Elderly is a direct service organization. So we apply for a CalGrows grant, and we actually receive a major grant so that all 411 of our employees could take these direct service or direct care classes. And over a course of 3 months, like 22 classes, and about 88 hours, all of the employees that have a direct care responsibility were trained, by our facilitators. Sometimes they are outside expertise. Sometimes they're, most of the times, these are supervisors and department heads who have the knowledge. Now, we brought along May Kwok here, who will share that as a caregiver, because Self-Help for the Elderly also have home health, Medicare certified home care and hospice program. We have an adult day healthcare center, and we also have 24-hour assisted living, right? So all our healthcare components need to hire. Probably all our graduates, started to also sometimes work for Self-Help and other CBOs who have these type of direct care occupations or positions. So CalGrows, allow us to have a chance to train internally our own staff, but externally, we also offer the renewal class and then the family caregivers, home health aide classes to family caregivers. So it's kind of like a comprehensive program.
So CalGrows, how will you be able to move forward at the end of August when CalGrows is no longer providing training? And can people apply to Self-Help to access CalGrows training through your office?
I think that right now our staff is working with Dr. Polk to see similarly. Some people ask, could the courses be digitized, right? Could they be captured in videotape? So I think that we already did some of them with the trainers, right? Agree to videotape some of the training. But on the direct, like the classes that May attended later that she'll talk to, those at the end of that licensed home health aide training, they all need to take a test. So just taking the course without a teacher, they would not get the license. And because the licensed home health aide class has to be taught by a registered nurse instructor. And at the end, after they pass the test, then the state of California issued the license for them to practice as a home health aide. So we're talking about two different types of courses. Some are, more informal, just for Self-Help for the Elderly employees. But for the external classes, they have to come and attend the 120 hours of home health aide training in person. But they also have a very large portion to do practical training in a skilled nursing facility. So that's a more formal kind of training.
And this really, as you have explained to me, is an opportunity for many people who enter the workforce as newly arrived immigrants to advance and develop career paths.
Exactly.
Training programs such as CalGrows.
Yes, we encourage everyone, to really take advantage till August. Sometimes during the pandemics and a lot of our trainees lost their jobs when they were working in the hotels and restaurants, right? A lot of immigrant workers. Then they started to come to us to look for other occupations. So healthcare is a growing field. As you heard from Dr. Polk, we're in need of 3.2 million, right, caregivers, professional and family caregivers, because the aging population is growing so fast. So getting into the healthcare field, we think that licensed home health aide is a first step. Then you could become CNA and then LVN, and then some actually even take the RN type of classes. So it's definitely a good career growth for them.
That's great. One or two questions for both you and Dr. Periyakoil. And one of these questions concerns whether or not you are seeing an increase in the number of Indian languages. And by that, I think the question is really about Asian Indian as opposed to Indigenous or Native American. Are you seeing an increase in demand for in-language care providing? Dr. Periyakoil, that may be a better question for you.
Definitely, as the Bay Area's population of South Asians, Asian Indians increases, there is a great need for this. So in response to this, we are trying to set up a free training offering provided in English and Hindi. There are different, obviously, different pockets of subpopulations of India with different languages, including Hindi, Punjabi, the Telugu, Kannada, Tamil, to name at least just a few. So we are trying to figure out how to be able to provide that in the preferred language.
Great. We have a question from Mira Kamai. Mira, do you want to ask your question? It's a good one, too. All the questions are good. I love questions. Mira, can you unmute? If not, I can read your question. What are the possibilities of the state and county working with community colleges to establish ongoing training vocational programs to launch this workforce? And that's a question also for Dr. Polk. And Annie, if you want to address that as well, because what she's really asking is, can these caregiver training programs that CalGrows is developing, incubating, as well as the programs you provide and Stanford under Dr. Periyakoil provide, is there a way of embedding these, or are they already being developed in community colleges?
I'll take a quick answer and Dr. Periyakoil could add to it. So for the first 30 years of our licensed home health aide training program, Community College San Francisco, now is City College, right, is our partner. So they provide the RN instructor and they paid for all the instruction. And Self-Help for the Elderly recruit the students and assign a teacher's aide, right, to help the RN instructor, because there's a ratio of 1 teacher to X students. But they have been a wonderful partner. But as time goes on, then the city college system could no longer support the bilingual. For self-help, we have to teach it in English and Cantonese. So when we couldn't get the city college to continue this curriculum, then it kind of forced Self-Help for the Elderly to look for other ways to continue this type of training, which is so important. So we finally got the state to approve Self-Help to be a direct training provider. This just happened about 2 years ago. Now we could offer, 3 classes without having to be totally dependent on the higher education like City College.
Great, thank you. Now we will turn to Ms. May Guo to share her experience as a trainee with CalGrows. And Annie, thank you for being the interpreter or translator in a way just even being able to summarize what Meg Guo is sharing with us. Thank you, Meg Guo.
OK，大家好，我係郭美春，今日好榮幸能喺呢度同大家分享我嘅故事。我喺2005年嘅11月，我踏上咗嚟美國嘅旅程，隨後就喺2005年嘅12月開始擔任咗普通護理員嘅工作。嗰個時候，我對護理呢份職業抱有無比嘅熱情，但同時亦都感到迷茫同埋挑戰。
Hello, everyone. I am Anni Chung. I am honored to be here today to share my story with you. In November 2005, I embarked on my journey to United States and began working as a regular caregiver in December of the same year. At that time, I was full of passion for the caregiver profession, and I also felt confused and challenged.
2008年，一位朋友向我介紹咗安老自助處嘅家居健康護理訓練課程，我好快就意識到呢個將係我職業生涯上嘅一個轉折點。經過一段時間嘅學習同埋努力，我終於喺08年成功畢業於安老自助處。喺取得執照之前，我一直以非執照護理員嘅身份工作。嗰一段嘅經歷令我深刻體會到擁有執照嘅重要性。首先，擁有執照最大嘅優勢係在於對職業嘅認同提升同埋專業技能嘅認可。呢個唔單止係增加咗我嘅自信心，亦都係讓我喺尋找工作嘅時候更具競爭力。更重要嘅係，佢為我提供咗好多嘅工作機會，包括喺醫院啦、養老院啦、護理機構同埋私人嘅家庭嘅提供專業健康護理服務。
At the beginning of 2008, a friend introduced me to the home health aid training program as self-help for the elderly. I quickly realized this would be a turning point in my career. After a period of study and effort, I successfully graduated from self-help for the elderly in 2008. Before obtaining my license, I had always worked as an unlicensed caregiver, which made me profoundly understand the importance of having a license. Firstly, the biggest advantage of having a home health aid license is the enhancement of professional identity and recognition of professional skills. This not only boosts my confidence, but also make me more competitive in the job market. More importantly, it provided me with more job opportunities, including providing professional home care service in hospital, nursing home, private homes.
其次，擁有執照之後，我能夠為我所照顧嘅長者提高更高質量嘅護理服務。這不僅提升咗佢哋嘅生活質量，亦讓佢哋嘅家庭成員感到安心。通過專業嘅訓練，我學識咗好點樣有效咁應對長者嘅各種健康問題，並能夠提供更貼身、更細緻嘅關懷。
Secondly, after obtaining my license, I was able to provide higher quality care service to the senior I took care of. This not only improved their quality of life, but also give them their family member peace of mind. Through professional training, I learned how to deal with more effectively with different health issues.
最後，我想講講安老自助處對單一語言唔係英語嘅求職者嘅幫助。對於好似我咁樣嘅移民嚟講，語言障礙係一大挑戰。安老自助處唔單止提供咗專業嘅培訓課程，仲為我哋搭建咗溝通嘅學習同埋橋梁，使我哋能夠喺美國呢個多元文化嘅社會中揾到屬於自己嘅位置。亦都通過呢啲培訓，唔單止提升咗自己嘅專業技能，更重要嘅係我哋學會咗點樣融入呢個社會，為社會貢獻自己嘅力量。
Lastly, I want to talk about how self-help for the elderly helps monolingual, non-English speaking job seekers. For immigrants like me, language barriers are significant challenge. Self-help for the elderly not only provide professional training course, but also build a bridge for communication and learning, allowing us to find our place in this multicultural society in the United States. Through these trainings, we are not only improve our professional skill, but more importantly, we learn how to integrate into this society.
在此，我要感謝安老自助處俾咗我一個寶貴嘅學習機會，亦都感謝所有支持同埋鼓勵我嘅人。未來我將繼續努力，不斷提升自己嘅專業技術，能為需要幫助嘅長者提高更好嘅服務。多謝大家。
I want to thank Self-Help for the Elderly for giving me such a wonderful learning opportunities, and also thank everyone who has supported and encouraged me. In the future, I will continue to work hard, constantly improve my professional skills, and provide better service for the elderly who need help. Thank you all.
Thank you so much. I'm going to go right to our last speaker in the interest of time, who represents, I think, many of us who are approaching the challenge of caregiving as family and friend caregivers, having the advantage of Ms. Kuo's experience as a trained paid caregiver. We now go to the reality of being a family caregiver. Joe, thank you for joining us.
Thank you, Sandy. Hello, everyone. I'd like to start by saying I really appreciated the metaphor that Dr. Periyakoil gave us about many more family caregivers being given the keys to caregiving without knowing how to drive yet. And I got my keys last summer. And I'm not very good student driver at caregiving. What happened is my sister, who took care of our parents until they died, she broke her ankle at my house, and this was on top of severe neuropathy. So these days, she can barely walk. She can't take baths on her own. She can't cook. She needs some help getting anywhere outside of the house, and sometimes inside of the house. And I can see the future. I'm a single guy. She doesn't have any children. And so we're going to be living together for a long, long time. And I can see the future, her future needs getting more and more profound. And right now, I don't think I have the skills to do that, to approach that future confidently. I'm glad to have heard about CalGrows. I'm going to sign up as soon as I can. But it's quite scary. And I'm someone who, during my career, I wrote quite a bit about healthcare reform. I wrote a little bit about caregiving. And I remember writing this one column arguing for respite care for caregivers, family caregivers. It was my sister wrote a column on her experience taking care of our parents and how she needed a break. And so I argued in this column for respite care. And let me tell you, I'd never received so much hate mail from readers on that column. Their sentiment was, don't expect the taxpayers to pay for your sister's vacation or any time off. It is your duty, your family duty, to take care of your parents, your siblings, cousins, or whomever, but don't expect a dime from taxpayers. And that was maybe 20 years ago. And so I applaud everybody in CalGrows at the State Department of Aging, even new journalists who are still working and hope to endorse these programs. But it's going to be a tough haul to to improve things. And just as I think it's going to be a tough haul for me personally, just today, my sister's insurance company denied her doctor's recommendation for bringing a home health aide into the house to help her take showers. That's another thing is all those editorials I wrote about Medicare for everybody. I never learned how, I never wrote a column that said, this is how you deal with an insurance company that won't pay for something that is obviously necessary to you and me. And so now I have to learn that on my own. Hopefully not. I mean, hopefully CalGrows would teach me how to deal, make appeals for home health care and whatever comes next.
You said, Joe, that one of your concerns was how to get over the gender divide as you would help your sister with showering and bathroom needs. It is something that would be hard to get over, but I know in the case of my father and of course, with a spouse, it's different, but these are intimate questions that need the advantage of professional trainers who have lived experience. That is what CalGrows is providing us online. And I thank you for endorsing with your own interest in signing up. No more powerful final statement could be made than the fact that you are eager to take advantage of this program. We have 3 or 4 minutes left, and I want to go back to all of our speakers and ask you for your best elevator pitch that we as journalists can use, perhaps as headlines, as we promote the CalGrows training program to our audiences who may not realize this exists. And I want to make note of how little people spoke of the incentive of $6,000 stipends for people who participate, who are professional paid healthcare workers in the home. What the whole emphasis of this hour has been on is care and caring and the need to do a more fulfilling job by knowing more and having more confidence. I think that is quite remarkable. So if we could start with Ms. Polk, just 30 seconds, what would your headline, and if you say, well, come back to me, I need a moment, that's fine. But journalism, as Joe will agree, is partly about writing good headlines. So we would love to hear your best headline for today's briefing that we can consider as we prepare our own reports to promote CalGrows.
Hey, Sandy, I think that Renita actually unfortunately had to drop off.
Well, Connie, you would be perfect for this. What is your headline?
I'll try. But the CalGrows program, really, I think it's a win-win all over. If you look at the situation in terms of it's helping build the workforce, it's helping to build workers with more knowledge, which also in turn it helps build better quality care for those that they're caring for. And currently with the CalGrows program, there's over 25,000 courses completed. Over 6,000 caregivers have participated to date. Over 2 million have been awarded in incentives, and there's still about 28 million available in incentives to award. So a lot of opportunity for a lot of paid and non-paid caregivers to take advantage of these courses and incentives.
That's a terrific headline, subhead, and opening first lead. Thank you. Dr. Periyakoil, you said a wonderful thing. You said this is not about them, this is about us. And I won't steal that headline from you, but give us another headline. Putting you on the spot, I know. A headline for CalGrows and the importance of training for both paid and family caregivers. You're on mute, Dr. Periyakoil. If Jessica, can you unmute Dr. Periyakoil?
She's
No?
unmuted.
Okay.
Yeah, can you?
Yes, we can. There you go.
Okay, there it is. Okay. Now I think I'll just layer on what Mr. Rodriguez was saying. In geriatrics, we always talk about taking the car keys away, right, from the patient who's not able to drive safely anymore. Caregiving is where you're unexpectedly going to get car keys. And we better be sure as a society that we train the drivers, otherwise we're all going to get wrecked. This is a us problem. This is not a them problem. And I put it in the chat as well.
Okay.
Some patients have low needs, but there are others where you're given the key to a 18-wheeler and then you have to drive, right?
Okay.
Where the loved one has so many care needs. So it's a us problem.
That's a terrific metaphor. Anni Chung, what would your headline be, and particularly for our Asian language media?
Something like our caregivers are undervalued, and CalGrows could shine some light on our unsung heroes.
Oh, that's a wonderful tribute. Thank you. Could you ask Ms. Guo if she has a very simple sentence to promote CalGrows training?
個訓練係好緊要，
有啲咩一句可以提供到即係 promote 呢個訓練，有冇一句中文
經過嘅訓練係特別好嘅，係俾咗好多嘅揾工嘅機會俾我嘅。
Training, professional training really helps caregivers to get the jobs that they wanted. Yeah.
Okay, that's terrific. Thank you. Joe, you, as the writer in this group, have the last word. What's your headline for today's briefing?
We need to shed more light on the challenges of caregiving, the lack of support in general. And the way to do that is to just tell more personal stories from the inside.
That's terrific. And that is exactly what the Department of Aging is encouraging us to do. We're providing fellowships to reporters in the ethnic media to profile the unsung heroes who are our healthcare providers at home, both paid professionals and family and friend. With that, a great tribute to the California Department of Aging for fostering and promoting this program as part of your master plan on aging. Thank you for the opportunity to share this with our media. Thank you so much to our great speakers, and this conference is now adjourned.